Hi Paige, I'm Grace. I'll be your student physical therapist today. I'm going to be palpating some structures on you. Some of those include the ribs and lower back, and then I'm going to move and do the back of your hips and your ischial tuberosities, which are right under the gluteal folds. All right, is that okay with you?
Yes.
All right, you can go ahead and lie down, put your hands back. And so I'm going to start with the PSIS, which I'm going to find your iliac crest and then just work my way medially and inferiorly until I come up on this bony landmark right here. And then so this is an important structure because it allows you to find some structures on the sacrum and specifically S2. And then also it is an attachment site for the posterior sacroiliac ligament. And so then I'm going to come up on S2 and then work my way down the sacrum and then out laterally to find the inferior lateral angle of the sacrum. And this is an important site because it's where the gluteus maximus inserts. And then also you get a ligament called the sacrotuberous ligament, which attaches here. And then it's going to insert down on the ischial tuberosities, which, is it okay that I touch right under your gluteal folds?
Yes.
Okay. So right down there, if you just use the palm of your hand and push up, and you will come across this bony landmark right about here. And that is the insertion for this ligament. And then also it's an attachment site for the hamstrings. And then as we'll come back up and work on the, palpate some of the ribs. So to find the 12th rib, you're gonna find the 10th rib first, and then work your way down inferior a little to find the 11th rib, and a little more to find the 12th rib. Once you find the 12th rib, you're able to find T12, which is right about here. And then from T12, you're able to work your way up to the rest of the thoracic spine or down into the lumbar spine. And working your way down, you're able to find L5 right here, which is where it's a common site for low back pain, and it also allows you to find structures on the sacrum. All right, now that my patient is in supine, I'm going to be feeling some structures around the anterior hip, and then we're gonna do the greater trochanter, liver, and then some stuff in the neck. All right, so I'm gonna feel your ASIS, so I'm gonna first find your iliac crest and then work my way until I hit this bony prominence right about here, this is an important structure because this is where the sartorius inserts. The sartorius is gonna be the lateral border of the femoral triangle. This is also the insertion of the inguinal ligament, and so that's gonna be the superior border of the triangle. So to find where the inguinal ligament is gonna insert, I'm going to take the palm of my hand and just run it down until I hit your pubic tuberosity. Is that okay?
Mm-hmm.
All right. All right. And then right about there, I can feel it. And then just make sure I'm right on the spot. I can take my finger pads and make sure I'm right on that area. And then, so to find the medial border of the femoral triangle, I'm going to ask you to cross your leg over your knee. Good. And I'm going to have you rest your knee on my hand, and you can push into my hand. I'm going to see that muscle pop out, and that's going to be the lateral medial border. And so in this triangle, we can find a decent amount of neurovasculature, including the femoral nerve, artery, and vein. You can also find the femoral pulse in here, which lets you know that there is adequate blood supply to the lower limb. There's also lymph found in the femoral triangle. Next, I'm going to palpate the liver. So that's found in the upper right quadrant of the abdomen. And so you're just going to drop off the base, the last 10th rib, and then just right down in there, you're going to feel a soft but kind of firm end feel. And as long as that's not tender, we're not going to need to refer that out to another physician, but if it was, I would have to refer it out. And next, I'm going to have you go into side lying. And so we're going to look for the greater trochanter. So just with the palm of my hand, I'm going to feel around, and it's going to be the most prominent structure. So got it right there, and then you can feel it with your fingers, and there is a good bit of definition there. This is going to be the the attachment site for many posterior muscles, including the piriformis. Also, you're going to see a lot of referred pain in this area from the low back, hips, and pelvis area. All right, and you can come back onto your back, and I'm going to move up to the neck. So first I'm going to palpate C2, so I'm just going to support you right there. C2, to find that, you're just going to drop right off the back of the occiput, and then it's going to be the first bony prominence you come across. All right, and if you move just lateral to that, you're going to feel the articular pillars and the paraspinal muscles. And then if you move just a little more laterally, you can feel those facet joints. All right, and then coming back in, you can work your way down the C-spine until you come across the most prominent structure. That should be C7 right there. But to check, we can have the patient flex their neck up and then extend it back. And that one didn't disappear, so I can move up one structure and then have them flex and extend, and that one disappeared with extension, so I'm going to know that's C6. And just below that was C7. All right, and then next, our last structure is the first rib. So to find the first rib, it's just the base of the neck, and you can just push down in here. It's going to be a hard, bony end feel, and from there, it's the attachment site of the scalenes, and it is also the base of the neck. All right, now that our patient is in seated, we are able to palpate some more structures, including the shoulder, elbow, and wrist. And then we will move on to the knee, ankle, and foot. Okay, so the first structure we're going to palpate is this AC joint. To find it, we're going to find the clavicle and the acromion process, and then just work our way laterally until we find the joint space. So that's going to be right here, and this is an important structure because it is a common site for shoulder separation, and it allows us to find multiple other structures in the shoulder. All right, from here we're going to work our way posterior and find the spine of the scapula. Spine of the scapula is important because as we roll transversely over it, we can find the supraspinatus superiorly and the infraspinatus inferiorly. All right, and I'm going to have my patient put her arm behind her so I am able to see and feel the medial border of the scapula, and this makes it easier to find the inferior angle of the scapula. The inferior angle is important because it is the site of attachment for the teres minor and teres major muscles, and we can see those pop out if my patient pushes into my arm, and we can see those right there. All right, as we come back, we will go back to the acromion process right here and just drop right inferiorly off there, and then we will be in the subacromial space. And this is an important spot because the tendon from the supraspinatus passes through here and is a common site for impingement. There's also a bursa in here and is a common site for bursitis. So next we are going to find the greater tuberosity of the humerus. I'm going to use the palm of my hand and just feel for that bony prominence. And this is important because it is an attachment site for the rotator cuff muscles and forms the lateral border of the intertubercular groove. From there, we're going to move anteriorly, and I'm going to find the coracoid process right in here, and you're going to have to palpate kind of deeper, but that's going to be the site of attachment for the short head of the biceps brachii as long as the pec minor. So as I work down the arm, I am able to come across the medial and lateral epicondyles, and I'm going to find the medial epicondyle right here, and just off that is the olecranon process, and then this is also the site for the flexor tendons. And then as I come over here to the lateral epicondyle, I am also able to feel the radial head, and we can have my patient pronate and supinate, and I can feel that radial head moving in between my fingers. This is also, the lateral epicondyle is also the site for the extensor muscles of the wrist. All right, and moving down, I can have my patient flex their hand like this, and if I feel right in here, I can feel the scaphoid bone, and this is a weight-bearing bone, so it has many articulations with the radius. It is also commonly fractured when you fall on an outstretched hand. And then also on the palmar side, we are going to come over here, and just off the ulna, I'm going to find the triquetral bone, which is right here, and the ulnar canal with the ulnar nerve and the ulnar artery is going to pass right around this area. And then just on the palmar side is going to be the pisiform bone, and this is an important bone for the attachment of the flexor retinaculum. All right, done with the hand. As we move down to the knee, I can use my palm to palpate the knee and move into this joint space. And then so I can move medially in the joint space until I am kicked out right about here by the MCL. I can move back medially. And in this joint space right here, if the patient inverts and internally and externally rotates, I'm able to feel the medial meniscus kind of kick my fingers out. All right, as I follow this joint space laterally, I'm able to feel the LCL come in right there. And from here, I will try to find the fibular head, which palm of my hand, it's going to be right about here. And this is a common site for the lateral compartment muscles to originate from. The biceps femoris is also going to originate from this, or insert on this bony prominence. All right, and we'll move up. The next structure I'm going to palpate is the talus. To find that, I'm going to come right between the two malleoli, and it's going to be right in here in the ankle. From here, I can feel the anterior talofibular ligament, and that is going to become taut with plantar flexion and inversion. And then it's also a common site for ankle sprains for a lateral ankle sprain. From here, we'll move down here to the base of the fifth metatarsal. And this bony prominence right here is going to be the styloid process. And this is the attachment site for the fibularis muscles. It is also a common site for the avulsion fractures. And then we will move to the medial side of the foot. And with my palm and my fingers, I'm going to feel for that first bony prominence. And that is going to be the navicular tuberosity. The navicular tuberosity is the attachment site for the posterior tibialis muscle. And it also helps us find the medial cuneiform bone, just distal to it. And then from there, we are able to find the other cuneiform bones.